Hi everyone, my name is Riku and I am delighted to be your moderator for today's resident member series talk. I would like to start by acknowledging that we are gathering on the traditional, ancestral and unceded territories of the Musqueam people. For those looking at the recording, the resident member series is a public event at Green College that features a different presenter or presenters from among the resident members of the college. Graduate students, postdoctoral and visiting scholars share their research or related topic in their field. With that, I am super excited to introduce today's speaker. Evan Hall hails from Michigan, US, and has led early career in revitalizing a new generation of advocates and researchers to end the HIV epidemic. At the heart of their work is their sustained commitment to engage with the community and people impacted by HIV. Since studying their master's in public health at UBC, Evan has further expanded the horizon of possibilities to support more sustainable drug supply chains at the intersection of climate change. Today, they will kindly give us a talk titled Sex? Please join me in welcoming Evan.
Thank you, Riku, and thank you, everyone, for joining us. I want to also acknowledge that some of this presentation was created on the ancestral, traditional, and occupied territories of the Anishinaabe, Souk, Mississauga peoples where I live in Michigan. And with that, I want to provide a little call to action against violence towards First Nations, Métis, and Inuit peoples, as some of the inspiration from my time here being part of a new queer community from my home state in Michigan has taught me the value of calls to action around communities that are vulnerable to specific violence. And first, I want to acknowledge the murdered and missing Indigenous women. There is a march this Wednesday that is actually happening if you want to explore attending that downtown. But it is the human crisis that embodies the high and disproportionate rates of violence and the appalling numbers of missing and murdered Indigenous women and girls in Canada. Please scan the QR code for more information. Additionally, much is needed to be done around indigenizing sex education, including a knowledge of the history and impacts of colonialization and a clear understanding of recommendations to sex education around community, creating space, holistic approach, and representation. All of this to say is that there is a lot of work in sexual health that needs to be done in order to decolonize and make progress. And so please learn and apply knowledge of bystander intervention in all situations for all peoples, and that's something that is taken from the Birdhouse, which is a queer space here in Vancouver. Now, for the moment you've all been answering for, this is how you have sex, engage in sex, and practice sex safely. Oh, I'm just joking. This is a Suzuki chemistry reaction that I did in undergrad. How relevant this is, it's just to make you laugh and enjoy this presentation a little more than you probably will. So, I want to have a little disclaimer here that these experiences are a culmination of years worth of one-on-one community and institutional level engagements. This does not constitute an absolutism to sex or sexual health. Importantly, one should seek their method of support to address sexual health needs, as this is not medical advice. So for those who are thinking about that in the discussion portion, please be mindful that I am not licensed in Canada. So, with that, the question becomes how to have more sex or not. So we're going to start off with our favorite thing related to sex, shame. So what is shame? Shame is an evaluation that brings forth negative, internal, global, and stable attributions relating to the self. And shame is quite pervasive in sex, whether it's occurring during sex, before, or after. And so this comes with statements like, I am bad, versus statements like we'll see later, which can recharacterize how shame is felt during, before, and after sexual encounters. Another favorite one, stigma, because shame and stigma often act together, is a social construct that is a process of social rejection, devaluation, and discrimination. And it's often come about in statements like, it's all in your head. So I want you to think to yourself, when was the last time you had a sexual experience? What went on during this encounter? Now, these questions might not necessarily bring about the stigma or shame that you're characteristically thinking about, but when a medical provider asks you these questions and you just have gone through a very extensive sexual history with them, it can be quite uncomfortable, especially if they're your family doctor, you grew up with them, or someone completely different who has no gender or any clue with what sexuality is. And so part of the discussion around shame and stigma with these questions is that oftentimes there are not safe or even culturally relevant spaces to present these questions in a thoughtful manner. And as an HIV STI test counselor, I had to be very critical that many students who I saw on campus and engaged in classes regularly might not feel that they can go to their healthcare provider to provide this information, even though, as you might have guessed by answering these questions yourself, these are pretty important questions if you're thinking about sexual health. And oftentimes, I was and have been the first person people engaged with around discussing their sexual health, which, if you can imagine, being 20 years old and being a healthcare provider in that regards can be a little scary, especially when you don't have all the answers. So let's talk about it in this way. Shame and stigma may prevent you from seeking health services. That's a fact. This is normative, but should not be normalized. A lot of the things that we talk about in sexual health spaces appear as normalized things around health disparities and inequities for marginalized and oppressed communities, but I like to think of these as more normative aspects of what society has pushed on these oppressed and marginalized communities to think is normal. And I want to talk about something that I engage regularly with clients during my time as an HIV STI counselor that discusses the de-escalation of shame and stigma. Importantly, we begin off by recognizing, naming, and understanding our shame and stigma triggers. There is nothing better to be asked the question of how many sexual partners have you had in the last 3 months and not having enough room to fill out that information on an intake form. Trust me, it has happened, and it might and will happen to you one day. Additionally, identifying external factors that led to the feelings of shame and stigma. Importantly, when you're entering spaces that are supposed to be nurturing spaces for your identities, such as entering a gay bar, there might not be people there who are the best educated on sexual health to give you advice on what you should and should not do. And so being mindful that when you are under the influence, which is a wonderful thing to be if that's your choice, making sexual health decisions might not be at the top of your priority list. And so always having an accountability partner to check in on you can bring about a way to discuss shame and stigma after the fact, during, or before to prevent these feelings that build up later on. And that leads us into point number 3, connecting with others to receive and offer empathy. No one feels good when they have a bad sexual encounter and someone says to them, well, was it your fault? Not a great thing to say. And especially when we're talking to medical healthcare providers, oftentimes when we share vulnerable sexual experiences and how we can improve that in terms of our sexual health, they kind of cock their head, perhaps roll their eyes, or even leave the room. And so it's critically important that you find and rely on your support system to engage in these conversations around shame and stigma, because ultimately this brings up negative attributes that later on can truly impact your health negatively, and not just your sexual health. Because importantly, I want to emphasize today that sexual health is not just a subset of your health, it is part of your whole well-being. And so that brings us to the final portion of de-escalation, speaking about our feelings of shame and stigma with others. I would not be remiss to say that if I didn't talk about how sometimes I feel ashamed during sexual encounters, or ashamed going to the club, or ashamed of what my physician asks me, I wouldn't be here. Because part of the engagements around setting community priorities is that you have to listen to the people that you're working for and working with to solve these issues, at really getting at the cause of why shame and stigma is normative for so many communities in sexual health. And so, addressing shame and stigma is a process and takes time. Our personal tools help manage, and our collective action help eliminates. And that's something I want to emphasize, that oftentimes when we are in medical settings that are isolating, scary, and often put us in the hot seat, as I like to say, it can never be easy to change the world alone. And so bring a buddy along to get yourself tested. Have someone you call afterwards, or when you get test results, who can you lean on to discuss those test results with? And oftentimes, those may not be your parents. However, it's important to know that in the context of the US, if you're on your parents' insurance, sometimes those tests will go back to your parents, and you might have to be prepared to have those conversations. It's not a reality that we like to discuss, but it's a reality that we live with. And state by state, it differs. And so the complexity of being a healthcare provider in the state and dealing with young, very anxious college-age students, some of us are here this evening, we have to know how to manage that. And part of that is around the de-escalation. And importantly, the collective action that I mentioned is that if we just all act in the system, relying on isolation to get the work done, we're not going to get anywhere. And so I encourage you to critically engage with how your prejudices, stigma, and shame around how other people show up and bring up about their sexual health can engage in those discussions to mitigate the harm that shame and stigma has in sexual health. And so this is important. Being diagnosed with a sexually transmitted infection is not a reflection of character or your place in society. Oftentimes, people who are diagnosed with a sexually transmitted infection can be stigmatized, shamed for who they are because of their gender, sexual identities, for how many partners they have, for what they did. A lot of people want to know a lot of information about other people's sex lives it is not relevant to them. You don't have to provide that information, and you can also trust that when you go to a provider, that confidentiality is our top priority. And part of that work for me as an HIV/STI counselor working on a college campus, I tested my friends. I tested people who I would see in classrooms, on the streets. And part of the things that I learned as my training in New York City was to go is I never engage with them. I never acknowledge them, because part of it is privacy and confidentiality. Because for some people, that could mean life or death. An acknowledgement as me, a very active queer HIV advocate on campus, an association with me could create harm, shame, and stigma that is sometimes unrepairable for individuals. And so for me, I only engage when they engage. And that's a critical aspect of this reflection of autonomy and agency around people who do choose to get tested, because it is a very, very difficult choice. And so what do we say to all this? Well, I like to say, yes, I have sex, because we know it. Come on, guys. Yes, I have sex, and so do many of you. So, to the next portion of the presentation. How to take a better nude. Hint, it may not be better lighting. And as you probably already guessed, it's not what you're thinking. Because I want to talk about bodily autonomy and sexual health. Because nudes are sometimes getting a flavor at what you're going to get, and sometimes they can be a hidden trap for shame and stigma to exist in sexual health. So I want to start off by defining what bodily autonomy is in my perspective in sexual health. And it is the right to make decisions about your own body, life, and future without coerce or violence. Doesn't that sound nice? Now, nude photos are treasured portraits of one's body, but can be used as coercive and violent tools against you. We've all heard terrible news stories, especially as AI deepfakes increase in popularity, the dangers around nude photos, pornographic images being spread easily in our spaces today. And so it's important to recognize that this isn't saying stop taking nudes. No, please do. With better lighting, of course, but to recognize the crucial aspect of how these are treasured portraits of our body and should not be used as coercive or violent tools against us. So let's take steps to improve our nude portraits. First, you have the right not to send a nude. Isn't that cute? You can say, no, actually, let's just do this in person. That sounds like a better idea. You can also opt in for sexting or voice calling. Yes, it might be embarrassing the next day to look at what you were sexting, as I have done before, but at least some revealing photos were left in the photo album, the hidden photo album for those who have Apple devices, because those who are unhinged and leave them in the normal album, go you. Voice calls are also very fun. FaceTime can be quite interesting. Always have a good stand for your phone. Don't just set it on the ground. It can be quite strange. So, again, 2 different ways to do that. A third one, create boundaries about when and to whom you will allow to send nudes. For instance, if they haven't shown their face, what makes you think that they want to see or you want to show them your... Yes, exactly. Yeah, don't show them your private parts without seeing their face for the most part because you don't know who they are. But it's also creating boundaries around specific interactions to whom you may have had previous sexual engagements with, whether those were romantic and or previous sexual partners. It's also important to recognize dynamics, perhaps between personal friends. It is a common thing. We will see how many of you react to this, but it is common to show your friends your nudes. Hey, does this look good? Does this make me look flattering? That is a great idea when you have boundaries around whom and when you want to allow nudes to be sent. So make sure you're in agreement. Perhaps go on a little coffee date. Show them, adjust the filters, adjust the lighting, but maybe not send them. Know how dating and sexual apps protect/safeguard nude photos. If you aren't aware how your favorite little apps, as you know, I am a queer, non-binary person who fancies the app of Grindr. So I am quite well aware how Grindr does it, but let's say Tinder, Hinge, some of them who don't send photos, but you send phone numbers. What about apps that allow you to send disappearing photos? Are you aware about the protections that are in place for you as an individual? Just think about that. And that might help you the next time you want to engage in sending nude photos to individuals who you may or may not know. So, this one is crucial for all y'all who are painted works of art. You can discreetly hide identifying features such as your face, tattoos, and scars. This might be critically important to preserving your identity for now or the future. That might be a conscious decision you make to not show your face in nude photos. That's okay. You can send a selfie later, and maybe if the person is creative enough, they can Photoshop them on top of each other to get a good look. Or you can just meet in person, whatever you're feeling. Tattoos, using apps, plenty of those to clear those up, especially those around the chest area and the feet that we don't necessarily think about all the time. And then also scars. That surprisingly is one that comes up quite often that people are very easily able to recognize. And lastly, familiarize yourself with relevant laws on nude sexual content on these apps. If you're really vested interest, you'll see that most of the time they're not in your favor and that you should be very conscious and advocate for laws that protect privacy and autonomy for individuals. I will say, as somebody who has experienced catfishing, with my own nude photos, I recognize how difficult it is to negotiate these boundaries. And I still negotiate these boundaries today, but these are 6 steps that you can take, and hopefully over time you can negotiate these better boundaries, can decide to say no, and you can opt in for a FaceTime call at 3 a.m. in the morning if you're really spicy. So, this begs the question, what is one goal you have in improving your sexual health practices? What/who will hold you accountable? This is one of the most difficult questions that I ask people who come in for HIV/STI testing, because oftentimes they're scratching their heads, even though they're college-aged, have a master's, perhaps a PhD, and they can't seem to think of anything to improve their sexual health practices. And I always like to say that there's no one right way to do sexual health, but there are a couple better ways that are setting you up for success than some other ways that perhaps lead to mis and disinformation that we want to stay away from. And so always think about this when you go to your medical provider and they just go through your sexual history list and they talk about all of the different things that might be wrong with you. Think about some of the positive potentials that might be in your life around improving your sexual health practices, because oftentimes medical providers don't ask you that question. And even more importantly, what are you going to have to be an accountability partner, or who is going to be that accountability partner? Because oftentimes when you go out to the bar, you go out to the club, let's be honest, sometimes our decision threshold decreases dramatically. And we don't necessarily think of that in terms of sexual health. We often think of that as a designated driver or somebody who's looking out for our drinks. So look out for your sexual health the next time you're at a gay club, a bar, or even a party, in the coach house specifically. So what do I have to say about this one? Well, yes, I do appreciate my body. It is something I treasure, something I honor, and it's something that every time I get to take a nude or send a nude or receive a nude, I get to appreciate how much time and energy someone put into that, perhaps some more than others. But I recognize that people are really putting in the time and effort to create human connection. And that's something that is often lacking in terms of sexual health. We think of each individual as their own autonomous beings, and when they come together to scootily poop, as I learned from John Green back in the day, it often can become a difficulty to understand how we meld those relationships that are one-timers, anonymous. And so be very conscious about how you're treating your body, how you're loving your body. So look in the mirror next time and say, I appreciate my body. I love you. And finally, why kinks don't stink? Well, sometimes they do. I'm going to be honest around that one. And so if this is your first time hearing the word kink, please strap in, get ready. This might get interesting. So, kinks, what are they and who got them? Right, that's an important question to answer, but let's just talk about what a kink is first off. So, a kink is a sexual behavior that falls outside of normative sexual practices. Remember that word that I mentioned earlier that is different than normalized? Because oftentimes our society frowns upon anything that is a little kinky, unless, of course, it's going to make a lot of money in the box offices for movies. So that is what a kink is defined as from my perspective. And this is important because it's different than how we define a fetish, which, again, they are not interchangeable terms, but they can fall under the same umbrella. So a fetish is a sexual behavior that is necessary for sexual pleasure and enjoyment. And so the common one that is mentioned is a foot fetish. So to all my foot fetish lovers out there, thank you for showing up today, because your example is important. It's relevant. People who engage in fetish activities, that's a necessary part of their sexual health, enjoyment, and pleasure. Go you. But importantly, those aren't necessarily always kinks. So let's talk about some of the kinks that we have here. I just want to read them off because sometimes it's just fun to say. We have BDSM, humiliation, pup play, furries, bondage, yes, flogging, orgasm control, dominance, age play, electrostimulation, gagging, yes, public sex, urophilia, underwear, voyeurism, and group sex. Now, not all of you will define some of these things as kinky. Some of you will say, well, this is just what I do, and that's great. But so for many people, this isn't a normative practice, which is okay. You're special. I love that for you. And it's important to recognize as well, each one of these kinks, which this is just a very limited list of the different kinks that exist, has some sexual health considerations that we really have to think about. You know, urophilia, for instance, electrostimulation, even orgasm control. You might be wondering, well, how does this apply to my sexual health? And how will my physician consider all of these in my sexual health? Because oftentimes we really don't want to talk to them about our kinks. And so I'm happy to answer questions at the end of the discussion, because as I was talking to my dear friends earlier, when we open the rabbit hole of sex, we would be here all day. So when we're considering kinks and how they interact with our sexual health, please be mindful that we don't want to consider this as an important point. I want to say before moving on is that the fetishization of individuals on the basis of race, ethnicity, sexual, and gender identity creates harmful spaces for sex. This is a very controversial topic within the kink and fetish community around where these particular identities play in spaces of sex, because for some individuals who engage in sex work, this is a crucial part of their income and survival. And so we are working towards dismantling those systems of marginalization and oppression that act through fetishization. But like progress, we're not there yet. And so this is a friendly reminder that if you hear language or actions or see something that is creating harmful spaces for sex on the basis of fetishization, there isn't, in my opinion, a justification around that, and there is and are better ways to describe kinks and fetishes that do not reduce individuals down to identities that may or may not be marginalized and oppressed in spaces of sex. So, consent in kink culture. We've had the opportunity at Green College to talk a lot about consent. And consent in kink culture can be very, very messy, and I mean that quite literally. So, consent is like, well, consent in kink is like going into an ice cream shop. Some people really just love vanilla, and they'll go into the ice cream shop 365 days a year and order vanilla over and over again. Maybe 1 scoop, maybe 2 scoop. But for some of us, we like to have a couple flavors in our back pocket that we choose from time and time again. But importantly, what stands a testament of time is that consent is part of the business of sex and sexual engagements. Whether you want vanilla, whether you want Moose Tracks, or my favorite, Superman, go Michigan, is that you are entering a business, and part of that business is you're consenting to be in that space and being aware of what that entails. And so, to the point of consent in kink culture, if you are in kink spaces, a lot of the times they do an excellent job at defining what consent is. Because there is, and albeit controversial for some spaces, non-consensual kink play is a thing, and so there are certain terms that people use, safe words that are engaged with, that can provide a safe way about going with kinks within sexual interactions. And I want to say that sometimes people just like to decide, well, I'm going to have strawberry ice cream today, or I'm going to have peanut butter. Those decisions might be one-off engagements, but when you go to the ice cream shop, you also know that you're going to the ice cream shop. So knowing that consent is part of sexual engagements and how you engage in kink culture or any sex at all, that's part of the process. And so it is on you and whomever you're engaging with to really have great, clear understandings of what consent means in the space that you're acting in. And I won't say my favorite safe word, but you should all have one. So, this is my favorite saying in kink culture, and it relates to my work as an HIV STI counselor. Don't yuck my yum. That's specifically around kinks and fetishes that sometimes you might not like it. And that's okay, because you wouldn't want to slap someone's ice cream out of their hand just because they ordered strawberry. So, when you go to the ice cream shop, respect what people are getting and recognize that you may never want to have the peach sherbet ice cream. But for some people, that's what they love. And so as an HIV STI counselor, I often get asked, well, how do you deal with people who like X, Y, and Z kinks that are clearly against their health? Well, I say to them, I'm not there to tell them what they can and can't do. I'm there to promote what's best for their health and their decisions. Because ultimately, if I tell them what to do, they're probably not going to listen. Let's be honest, people. Because honestly, if you like the type of ice cream you like, sometimes it's hard to change to a different flavor, or sometimes it's just not for you. And so I'll use two examples to demonstrate this in a way that is one more relatable and one more difficult to discuss within the HIV community. One of them is always poop play. Yeah, as you guessed it, the engagements of feces within sexual interactions as part of a kink. Now, that might be really challenging for me to digest as a healthcare provider in a setting that's, wanting to make safe, clean spaces for individuals. But I have a conversation with them. Where are you doing this? How do you clean up afterwards? How do you keep yourself clean? Do you regularly test for STIs more often? Do you talk to your physician about perhaps other infections that are common within feces interactions? Those are all things to keep in mind. Just because you eat your strawberry ice cream doesn't mean you should just neglect what's inside of it. That could be really harmful if they have chemicals or things that you're not aware of. And so just because something's really yummy to you doesn't mean you shouldn't be aware of what you're putting in your body or letting things be put in your body, of course. Another difficult one that has been something that I have been grappling with, and in my own journey as an HIV test counselor, trying to support and understand, is people who engage in sexual activities in order to transmit and receive sexually transmitted infections. And so I would like to say that the stigmatizing term for this is bug or virus chasers, which isn't necessarily representative of the people or identities that are engaging in those sexual acts. And the discussions that I have with those individuals can be really tough, because ultimately what I was talking about earlier around shame and stigma, that comes up frequently for them in those discussions. And so ultimately, I'm not there to tell them in their journey of sexual health when to stop X, Y, and Z. I'm there to help support them in their own journey of sexual health and in the collective journey of all of us to provide and ensure that all of our sexual health is taken care of. And so with those conversations, I always ensure that I'm listening to what they need as an individuals. And I hope they come and see me more often, get tested when they can or when they want to, and just ensure that whenever something comes up, that a friendly, smiling face can be there to support them. Because, as I said earlier, just because you get an STI doesn't mean you should be shamed, doesn't mean you should be stigmatized. It just means you're human and that you like to have sex. Go you. So, this leads me into the question, do you feel like your sexual needs are being met? What can you do to enjoy your preferences safely? That's how I always frame these questions, because ultimately when they do come in to see me as an HIV STI counselor, I want to make sure that they know I'm there for them. Let's just help generate some ideas, because ultimately sometimes idea generation around sexual health and how we can best practice our sexual health safely isn't easy. And also recognizing that the word safe is very challenging in spaces where individuals may not be safe. And so we have to be conscious that these baseline needs of individuals may not be met in the first place. And so we want to think of these questions before you even go into the doctor's office, before you even go into a sexual encounter. Ask yourself, are my needs being met? And can I do this safely? Do I have someone I can text? Do I have someone I can call? Do I have my backup plan? Because trust me, I've been in situations where I may be feeling kinky, but unfortunately I have a little indigestion and I might need to go for a lactose-free option. So those are decisions that you as individuals can and should make, because sex should be enjoyable. So I want you to say to yourself, yes, I like what I like, and be proud to say that. Because ultimately, no one should shame you into thinking otherwise. No one should make you feel stigmatized based off of who you are around what you should enjoy. And also to recognize that not everyone engages in sexual activity, sometimes on the basis of cultural or religious or sexual identity preferences or decisions or identities. Like our asexual fans out there. I love them. And so sometimes we have to recognize that no, I fulfill myself differently. If people are saying, well, the only way to have good sex is to have a sexual encounter or sexual intercourse with somebody. If you haven't heard of outer course, Google it. I love it. It's so much fun because penetration is not all the game all the time. So that's the portion of the content that I want to cover, but typically we start off with the places in the world and the about us, but why not learn who's behind the HIV STI counselor who is trying to do good work around sexual health and the places that I've been. So my little home state of Michigan there, where I grew up for 22 years, I went through public schools, went to a public university, learned about my hearing disabilities, and also was diagnosed with Crohn's disease. There's my lovely family in the bottom there. They keep me grounded in who I am as an individual. As many of you know, I have a special relationship with them. And then I also want to recognize my grandma Jackie, who is, if you don't know her, she's the one that I spent most of my summers with growing up, traveling around the US and learning what it means to be grounded in where you are. And there's my favorite picture of me on her mountain in her backyard. It's one of my safe and happy places I go to and try to go to every year because it's a place where I can reflect on who I am as an individual. And this presentation wouldn't have been, or I can't even describe how important this individual down here, Leon Golson, who is at Unified HIV Health and Beyond in Ypsilanti, Michigan, who set me on the course and trajectory where I am today. I kind of got into HIV work mistakenly. I didn't know about HIV until I was in college, and it was kind of rattling when I figured out that, holy shit, I didn't learn about this growing up. And so after a presentation that Leon gave, he said, hey, if anyone's interested in joining the Michigan HIV AIDS Council, we'd love to have you. And as many of you know, I'm an ambitious person, and I just ran up to him and I said, I'd like to be on there. And I served with the Michigan HIV AIDS Council for over 3 years. And it stood the test of time that people who are doing the work, who have the expertise, who have the knowledge, are the people who we should be listening to in terms of ensuring that communities are prioritized. And so with that, I'd like to end my presentation. Sex, sex, sex. Thank you.